HPV test results, understanding colposcopy and biopsy. When your HPV test shows abnormal results, it can feel confusing or worrying. But these results are just a starting point that helps your healthcare team decide what to do next. Often, an abnormal HPV test indicates the presence of high-risk types of the human papillomavirus, which can sometimes cause changes in cervical cells. To get a clearer picture of your cervical health, your doctor may recommend a colposcopy and possibly a biopsy. A colposcopy is a detailed examination of your cervix, vagina, and vulva. During this procedure, a healthcare provider uses a special magnifying instrument called a colposcope. It looks like a large binocular microscope and stays outside your body. To see better, a speculum is gently inserted into your vagina to hold the walls open. The doctor then applies mild solutions like acetic acid, which is similar to vinegar, or iodine to your cervix. These solutions help highlight abnormal areas by causing changes in tissue color or staining, making it easier to spot suspicious spots that might need further investigation. If the doctor notices areas that look unusual during the colposcopy, they might take a small tissue sample called a biopsy. This involves removing a tiny piece of tissue, often smaller than a grain of rice, from the suspicious area. The biopsy is usually guided by the colposcope to target the exact spot of concern, especially near the junction where most cervical abnormalities develop. Sometimes, multiple biopsies are taken from different areas to ensure all abnormal tissue is sampled. The procedure is generally quick, and local anesthesia can be used to minimize discomfort. Some women might feel a mild pinching or cramping during the biopsy, but serious pain is rare. Once the tissue sample is collected, it is sent to a laboratory for microscopic examination. The pathologist looks for signs of precancerous changes, known as cervical intraepithelial neoplasia, or for signs of early cancer. The results from the biopsy help your healthcare team determine the next steps, whether that's close monitoring, treatment of abnormal cells, or further testing if cancer is suspected. After the procedure, it's common to experience some light bleeding or discharge, similar to a light period, and mild cramping. It's important to follow your doctor's instructions about activity restrictions and follow-up appointments. The results from the biopsy are crucial because they give a more precise understanding of your cervical health and guide your treatment options. In summary, if your HPV test results are abnormal, a colposcopy and biopsy are essential tools to identify and assess any cell changes. These procedures are safe, well-established, and play a vital role in early detection and prevention of cervical cancer. Remember, every case is unique, so always discuss your results and next steps with your healthcare provider to get personalized advice and care.